Hey, everybody, welcome back into another edition of the drbicuspid.com podcast. My name is Kevin Henry. Honored to be the editor in chief of Dr. Bicuspid, as well as honored today to be talking about a very important topic. We're going to be talking about the senior oral health care crisis in the United States. How do we fix it? What do we need to know heading into 2026? And I'm really excited for this topic today. And I'm excited as well to be joined by two experts in the field. And that is, let me introduce first Dr. Candace Mitchell, who is the Associate Dean of Clinical Affairs at Howard University College of Dentistry. Dr. Mitchell, how are you today?
I'm great and happy to be here and happy to talk about this very important topic.
Well, while I'm giving you the mic, would you just give everybody a little bit of background about yourself, if you don't mind?
Of course, thank you. Well, I will say I'm a graduate of Howard University College of Dentistry. I'm a fifth generation Washingtonian. I've lived here all my life and choose to stay here. So I have a rich perspective on the local area, as it were. I have worked privately early on in my career. Most of my career actually was focused in public health and ended up in academia. So this is really something that is very near and dear to me. And it's a topic that's very near and dear to me.
Well, glad to have you on. Excited to talk about it today. And thrilled today to also have Dr. Usman Ahmad, who is the Administrative Dental Director at Mary Center. Dr. Ahmad, how are you today?
Doing great, doing great. And thank you for having us. I'm very excited to talk about this topic.
Great. Well, before we dive into it, I'd love for audience to just know a little more about you at Mary Center as well.
Well, yeah, a little about me. I'm from the area. I lived here basically my whole life. I went to school in DC also. I'm also a Howard University graduate from the College of Dentistry. Dr. Mitchell was overseeing me when I was there. It's great to just stay in the area once I was done. And it's great that we had this partnership that we're working closely together.
And Mary Center is in the DC area. Tell me a little bit about what that is.
Yes, yes. Mary Center is in the DC area. It began in the DC area. The majority of our locations are in DC. We do have two locations in Maryland, which is right across the border. It's not too far. So we get some of the DC patients over there as well as some of the Maryland. We're able to capture a little bit wider range.
Well, Dr. Mitchell, let me throw the first question to you. I know we are talking today about that there's a crisis whenever it comes to senior oral health care in our nation. Is it an urban versus rural thing, or is this something nationwide that we need to be paying more attention to?
Well, actually, it is not urban versus rural. While the areas present themselves differently, the challenges actually end up being quite similar. We assume a lot of times that, older people are retired, they're living their golden years and all that. But what we don't always recognize is that there are times they're just on a limited income. They have different insurance coverages. They have in different insurance companies coverages in that they're no longer covered for the things that they took for granted while they were working. We also have the wonderful news that people live longer all over the country, and it's a great thing. But as you have aged out of regular working and you retire, you might live 30 years past retirement, whereas 25, 30 years ago, you maybe lived 10 or 15 years past retirement. So we have to keep all of those things in mind, and those are kind of universal.
And I will say, both of my parents are still living. I'm very thankful for that. They're both in their early 80s. My mom is diabetic, having a lot of dental issues right now. My dad is covered through VA, but just the differences that I see in them, their coverages, how they approach their dental health is fascinating to me. And Dr. Amata, I'm curious, whenever you are seeing seniors, what are you seeing from their viewpoint about their oral health, and what do we need to know in the dental industry to maybe be more cognizant of that?
One of the first things I know for the patients that we see that we come on in, it's a lack of understanding of how to get their oral health in a better care. I think a lot of the patients we see from our senior oral patients, they come in for emergency care. They're in a lot of pain. They're just trying to deal with one issue. And from my standpoint, I'm trying to educate them like we could do more. We could get you to a better standing. Let's get you functionality back. Let's not deal with the pain at the problem at hand with the pain, but as well getting you further, getting you functional status back, getting you replacements in areas that you can going. We don't have to pull out teeth. That's also a thing I always try to let our patients know. There's more than we can just do. We can actually bring your oral health back into good standing, especially with patients, like you say, diabetics as well. That's a big population base that we see. And with the loss of bone that goes on with those patients, we have ability to somehow retain their teeth, and we don't have to always go out the easier out just pulling out teeth for every single patient. So just an education standpoint.
Let me just follow up with you on that, because I know so many of the older generation was raised with their parents having dentures, and the pulling of teeth was just not that big of a deal. How do we change the mindset, as you said, to making sure that they understand keeping those teeth is important?
Honestly, it's just education, showing them where we can get to. I think we have a lot of technology in the field that we can even show them where we can go. We could take images and show them, we can get you teeth back and we can get you, this is the smile we can get you back in good standing. So mainly it's just education, using what we have at our hand, or with technology, with the way the field has advanced.
Dr. Mitchell, I know that there's some kind of a blueprint maybe to make sure that we are taking care of our seniors with their oral health. We've talked about education. Is that a big part of the blueprint? If so, what else is included in that, in your opinion?
Yeah, absolutely. So as part of that, we try to provide primarily comprehensive care here because that's pivotal to a student's education for for dentistry. But with regard to our seniors, yeah, we have outreach that I know Dr. Ahmad is very familiar with. That's one of our tenets here at the university is service. And all of our students are required to do that outreach, but they also grow to love it. And so they go out, we go to senior centers, we go to different places and provide educational opportunities. In addition, while patients are here as part of the curriculum and part of the training of our students, we have to provide information and education to our patients. And it's also not safe to assume that patients are uneducated or they are socially challenged or economically challenged. It's just not simply put out there enough. We try to make sure that we link specific chronic diseases that are common in older years to their oral health condition and also link some of those diseases being more severe to how they take care of their health. So their oral health. So as a result, we try to bring it in all together. And that's a big strength. And that's also a big strength with our partnership.
Let me follow up on something you mentioned earlier because you talked about the financial situation that so many seniors face. How do we get them the care that they need, knowing that they sometimes the financial means may not be there? And how do we work past some of the things that maybe shut down in their own head when they're faced with that?
Well, for us, because we're an academic institution, we have a lot of manpower. We have a lot of students who can see a lot of patients. And while we do have to be self-sustaining with some regard, we are able to give them affordable care based on the fact that our overhead is probably a little bit lower than someone who's employed and trying to make a living and delivering care and dealing with the other things. Of course, supportive foundations such as Delta Dental, that's very helpful for us because recognizing that as we build these partnerships with each other and the public sector, we have to get our message out to others so that we can help pivot and go in the direction where the patients need help the most.
Question for both of you. And Dr. Mitchell, since you've been talking, I'm going to let you keep going if that's okay. You can lead it off. But as we enter into 2026, what do we in dentistry need to be doing better for our seniors? I know we've talked about education, we've talked about a few other things, but should be our New Year's resolution in this capacity?
Listening to them. That's a big piece because change is inevitable, change is constant. And we know there's a lot of things going on right now. We know as we go into 2026, for example, there's some major public benefit changes that are going to impact our seniors with certainty. That there is no doubt about that. So we need to listen to their challenges and figure out how we can work together to still accommodate them.
Ramad, your thoughts?
I 100% agree with that one. Our patients, they present with a lot of problems and a lot of issues that go on. And if we don't listen to them carefully and thoroughly, we can't solve some of the problems that we have. I just know working with the Mary Center, we've heard transportation issues. We got funding for Uber rides to get patients into the clinic. We've heard other barriers that have prevented patients from completing their care. And if we don't take our time to just listen to them, I agree with Dr. Mitchell. That has been the biggest component because we can't make change unless we hear exactly where the barriers are.
And one thing I want to emphasize, we're talking about listening and hearing. That's not just on the dentist side. Let's make it very clear. That's the team members as well. Making sure that whenever that patient walks in or is seated in the chair and that assistant has a chance, it's important for that person to have those communication skills and understanding just as much as the dentist, correct?
Absolutely. Yes. Yeah. And we work with our teams to, make sure that they're sensitive to what they get from the patients. We get lots of messages from people. And again, I don't know, I keep saying it, listening. It's just the most critical piece here.
And I agree. It's not just listening among our team members. I think one of the great things we have going on in the DC area is the Senior Oral Health Coalition, and just listening among the other clinics to hear everything that's going on. It's been quite eye-opening and gratifying also because we've come a long way from where we started, I believe, in 2022 to where we are now. We made some changes and made improvements, and just listening is probably the biggest key to everything.
Well, I know we've talked about a lot today, and I want to wrap up by asking each of you, just give me that one thought that if anybody walks away from listening to this podcast, that you want each of them to take away whenever it comes to seniors in their area and their oral health care. Dr. Ahmad, I'm gonna let you go first.
Well, the one thing I like to everyone to take away is just taking our time and caring for everyone, especially our elderly population. I feel like it's a population that it's kind of been overseen a lot. I know from the outreach that we've done going to local centers, and it started with Howard, to be honest. If it wasn't for Howard getting us there, me being a Howard graduate, they got me into going out to the community. And I'm thankful I ended up with an organization that we really push that message as well. And we actually make change over here where we go out to the community and just helping each other out. Just being able to be mindful of all our patient base and our population and trying to help everyone out the best we can.
Dr. Mitchell?
I think some of the thoughts I'd like to take away are our collective strength, meaning our partnership and the strong sense of community that we share with our seniors collectively.
Absolutely. And again, personally, I'm very biased. I know how important it is whenever I go back to see my parents. I know that's one of the conversations we always have is about their oral health, what's coming next, when's the next dental appointment, things like that. Thanks to both of you for what you're doing for seniors. And I'm hopeful that a blueprint can really help seniors around the country and all of us in dentistry embrace their needs and challenges a little bit more. So appreciate you both being on today.
Thank you
Thank
so
you.
much for having us.
Absolutely. And thanks to all of you for listening to this episode of the drbycuspid.com podcast. Important topics to think about as we head into 2026. How are you working with the seniors in your community and that listening aspect? How well is that being done in your practice as well? Till next time, it's Kevin Henry, editor in chief, signing off. And as always, wishing you nothing but success.